Hi, I'm Dr. Austin, and you are at the Trigenics Treatment Center about to begin your total treatment program. One of the things that's very, very important is for you to warm up properly prior to your treatment, and there's a number of reasons for that. One of the things is that research has shown that in order for rehabilitation to be maximally effective, you need to do a little bit of cardiovascular training just prior to the treatment. And the research studies that they've done on motor vehicle accidents and various injury patients and athletes is that if a warm-up is done that gets the blood flowing, then the treatment actually works a lot better and it's easier to do. The other thing is there's some degree of spinal mobility and pelvic mobility that we want to create prior to the treatment, which will also facilitate an easier treatment to be applied and will facilitate the manipulative procedures that need to be applied considerably. So we're going to start now today, and what you're going to do, you can watch this video at any time. The first thing that you're going to do for 10 minutes is you're going to do this Nordic track right here. You're going to get up on and hold on to both hand railings first so you don't stumble or fall. Make sure you've got running shoes on and loose clothing. And start with one foot up like this and then raise up onto the other one. That's the way to get up onto it. And then from there you're going to go not backwards. You're going to feel like you should be going backwards, but you're going to actually go forwards. This way. You can go at whatever pace you want. I like to go pretty quick, but you don't have to. And what you're going to do with this, well, you'll probably go at a nice, easy pace, but as fast as is comfortable for you. What you want to do is get the heart rate up. And what you're going to do when you first start out is you're going to set this timer here for 5 minutes, and then you're going to work your way up so that it goes to at least 10 minutes. So you want to be doing 10 minutes of this Nordic track as a warm-up before you start your exercises. The next thing that you're going to do is you're going to take the seat here, this seat with this funny looking cushion on it, and you're going to sit all the way back on it. Depending upon your ability, you're either going to keep your feet on the ground or you're going to raise your feet off the ground like this doing these exercises. The first thing that you're going to do is rotate all the way around. This is just for general spinal mobility. Forward and backward. This is only a total of maybe 5 minutes, so you can even set the timer again for anywhere between 3 to 5 minutes. You don't really need to do it too long. And you're going to go sideways, forward and backward. I can feel that I really need this. But if you really want to get the maximum out of it, you'll do it by raising the feet up. The farther out you put the feet, the more difficult it will be. The closer in you hold it, the easier it will be. If you hold it far out, you'll see that you really have to use all of the muscles in your back, the small muscles. Depending upon which direction you're going to hold on down here, and it's really a good workout for the lower back. But not only is it a workout, what it actually does is the discs in your lower back don't have a blood supply after the age of 19, only to the peripheral third. And the discs depend upon movement. And most of us have sedentary jobs, so if we're standing for long periods or sitting for long periods, those discs don't get the proper nutrients and water. And so what this is actually going to do is two things. First of all, it's going to loosen up the joint so that if you do need some manipulation during your treatment, it'll be easier for the doctor, the Trigenics doctor, to do it. And secondly, it's going to actually rehydrate those discs. If some of you have lower back problems, then the treatment, and it's this particular exercise done on a regular basis, daily, has been shown to actually increase the disc heights. So if you have a low back condition and you're attending this treatment center, it may very well be that we give you a type of cushion, something that looks like this, that's filled with air to a certain degree, and you'll actually use that at home as well. Okay? So 3 to 5 minutes of that, 5 to 10 minutes of the Nordic track. Okay? Minimum 5 to 10 minutes. And then what you're going to do is you're going to go to the wobble board. This is for what we call proprioception, which is the little nerve sensors inside your whole spinal column. And you're going to either do it without support, start with one foot all the way over to the side like this. You make sure you have running shoes on. the other foot up here, and you're going to go all the way around. Now you may need to put your arms out, like I am here. You may need to put them out, or you may hold them in, which is even a little bit more difficult. You're going to go around in both directions, touching the edge of the wobble board to the floor. Or we're going to go back the other way, which is more difficult for me to do. As you can see, I'm struggling going this way. But this is a fantastic way, and you're going to use your knees and use your legs. Now, if any of these exercises cause you a problem, make sure that you discontinue them and report them to me or your Trigenics doctor. Okay, the final thing that you're going to be doing as part of your routine is the fit ball. And what you're going to do is you're going to get out the fit ball that's the right size for you, either the green one or the pink one for smaller people. You're going to come over to this machine. You're going to make sure that inside the machine here, in the VHS unit for now, is the fit ball exercises VHS. You're going to push that in if it's not already in, and you're going to back it up, or if it's been used already, or rewind it. Hopefully the last person will have set it so it's starting here. Warm up spinal mobility. Let's go back to that again. Warm up spinal mobility. And when you finish this tape, doing this tape, I want you to back it up to warm up spinal mobility, so that the next person using it, warm up spinal mobility, when he presses the play button down here, it'll start with this. And then what this video does is you're going to follow this video, and you're going to follow the person on this video.
And again, deep breath
up. You're
up.
going to do the warm-up spinal mobility, and then
and exhale.
You're going to do the
We're going to start with the front to back roll.
Next chapter on this. So you're going to do warm-up spinal mobility, and the following chapter you're going to do 2 chapters. Now, if you have enough time and you want to continue on, the chapters get harder as they go on and more involved, and you can come in early if you like. You can spend as much time down here as you want if you want to go through the entire tape. But the first 2 chapters are the warm-up spinal mobility, and the cardiovascular chapter are the 2 chapters that you want to be doing prior to your treatment. Okay, so what I'm going to do now is I'm going to back it up. What you can do is stop it and then back it up. I'm going to back it up so that the next person will be able to turn it on and start it at warm-up spinal mobility. The other things that will be given to you will be for most of you, will be a web exercise program that's going to be sent to you by email, and you'll have a private password that you'll be able to go into your own program, and you'll be able to click on the exercises in that program and actually see and watch a video. These are exercises to be done at home, which are the ones that are on there without any equipment, or they're exercises that can also be done here if we happen to send them to you and they've got a fit ball, or they've got a TheraBand, one of these things in it, or they've got weights, which you've got over here. We may send you by email a program where there's some exercises that don't use any equipment and other exercises that do. For the exercises that do use equipment, you will use the equipment down here in this room, and the other ones you will just do every single day at home. Spinal exercises have to be done on a daily basis to be most effective. Every single day you have to do them, not 3 times a week like, you know, weight trainers and all that, but every single day you have to do your exercises, especially during your treatment program, where the program won't be as effective as it should be. In addition to that, we may also elect to give you some other types of exercises, things like this special machine that you put your neck into to increase the curvature of your neck if you've got a problem. There's various different forms of TheraBand exercises down here. There's all different grades of TheraBand. The Trigenics doctor will possibly give you some additional exercises either by email or personally that need to be done. We've got inversion units here, and of course we have a universal gym that can also be used. So that's basically it for today, and Our entire objective is to get you better as quickly as possible, but you have to remember that 80% of the responsibility of getting better lies on your shoulders, not on the doctor's shoulders, because you're the one that has to come in for the treatments, you're the one that has to do all your homework and do all your exercises, and have to keep doing that, because we're going to train you and educate you as to what it is that caused your problem to develop and what it is that you need to do on an ongoing basis to prevent its reoccurrence. I'm Dr. Alan Olo-Austin, the founder of Trigenics and the founder of the Trigenics Treatment Center.